All right. Good evening. Good Monday evening. It is 5 o'clock, a time we come together every single day to make sure that we do what it takes to defeat the coronavirus and protect one another. And as you know, what you have done to date is very, very special. When we look at projections, anything anybody predicted for the devastating toll that this virus would take, it's your work as Kentuckians coming together, doing what it takes, passing this test of humanity that has protected so many people. And for that, I'm eternally grateful. And I think every other Kentuckian, when we're able to look back at this, will be eternally grateful as well. We come together at 5 every single day to remind ourselves that we will get through this, and we will get through this together. So say it with me, like we do every night. We will get through this. We will get through this together. One more time. We will get through this. We will get through this together. And we will get through this together because every night we talk about the 10 steps that it takes to get through this together. It makes sure that we never forget that what we are doing that has worked so well to now is still critically important even as we move forward with a strict, careful, and gradual reopening that will protect lives. We wouldn't take a step if we didn't think that it was safe, that it offered, it's going to offer an amount of risk no matter what we do, but that it isn't measured and one where we believe that we can do this as a Commonwealth. Remember, staying healthy at home is the number one rule that helps us to protect one another. If you're not at work, if you're not getting groceries, if you're not getting exercise, be healthy at home. And while we're talking a lot now about healthy at work, after you're done at work, you got to be healthy at home. If we're going to allow contacts to expand, to reopen parts of work after work, it has to be immediately home. Remember, this is a gradual thing where we have to lessen the growth of contacts to make sure that we don't have that second spike and that we are able to protect one another as we go through it. Avoid crowds and gatherings. Practice social distancing. Know when to seek care. Make sure you are going to this website when you have questions, kycovid19.ky.gov. As we are going through healthy at work, gradual phase, strict restrictions type of reopening, it's going to become more and more and more important because there's going to be a lot of guidance on there. Wash your hands. Again, if we're going to start taking additional steps, washing your hands and disinfecting surfaces is going to be just as important as it was 3 weeks ago. And I know we're not doing it as much as we did 3 weeks ago. So let's make sure that we start up in our game again. Apply for benefits. Want to give a very quick unemployment update, and then we're going to have a specific update from Josh Benton tomorrow. So last night, 150,000 claims were processed that were being held up at $174 million. That all went out last night. It either should be going into people's bank accounts today or those checks ought to be mailed. Most of those are payments that people who had already qualified for unemployment had not received. Now, I made a commitment that we're going to take care of those that applied in March this week. So in March, a total of 282,000 claims and a little bit more were filed. 183,000 claims have been paid out thus far. Tonight, 70,000 claims of people who applied in March but haven't thus far received anything are going to be paid out. So 70,000 Kentuckians who rightfully have been waiting and have been impatient. You should be. These were March claims, right? Those will be paid out. That's going to leave us with about 30,000 claims that we are going to resolve this week. Now, understand that, unfortunately, it's going to take a little bit of time in these because a couple of bad apples can make this challenge that much more difficult. For instance, we had somebody apply for unemployment for Tupac Shakur here in Kentucky. and that person probably thought they were being funny. They probably did, except for the fact that because of them, we've got to go through so many other claims that one person thinking that they were funny, using somebody else's identity, is going to make tens of thousands potentially of other people wait. It's not okay. We can't be doing that, and we shouldn't be doing that as we move forward. But even with that, our goal is to get through those last March claims this week. And I'm going to have a number tomorrow for those after the payments have gone out tonight that are still waiting, that they can call directly. It's going to be just for them. Because if you filed in March and you haven't received anything yet, I'll be darned if we are not going to get it done this week or we are not going to communicate with you. We're going to. So it's unacceptable. This is the deadline that I've set, and we are going to meet it. All right, prioritize your mental health. And for those that are waiting, I hope that's helpful, but I know that it will help when that comes in. But this is just difficult every day. And I know we can be up and we can be down. That's just what this virus is. But let's make sure that we engage in that self-care and that we're there for each other. Don't travel and report non-compliance. And especially as we are able to start opening up, that is going to be that much more important. So we talk about our 10 steps that we follow every day, plus one, you got to fill out your census. I'm going to keep talking about this until we are in the top 10. Because if we're in the top 10, rebuilding is going to be easier. Now, it's not going to be easy, but we're going to have more dollars flowing in and a better ability to do it. So here's where we are as of today in our update. So here's our dashboard. We have moved up to 16th place. Again, take that, Oregon. But we are, less than 2% from being in the top 10. 2%. So if 2% of Kentuckians, 2% of Kentuckians filled this out tonight, we would be in the top 10 of states that have responded to the census. We need to be in the top 10 states that have complied with the census. Here's a little bit of the counties. As you break them down, as you notice, they are all over Kentucky, but we need to do better. I will tell you that even our leading county, Oldham County, where you're doing a good job, you have fallen out of the top 10 counties in the country who have applied for it. So let's get online. Let's make sure that more of us fill it out. Again, we've got our rankings by city. We've fallen, with the exception of one, in the top 10 or top 20 rankings nationally in that. So fill out your census. We need you to do it. It's another part of your duty as a Kentuckian. We also ask you each and every day to model the type of behavior that we need to see. And going through this is hard, but we can find some joy in the good things we do for other people, how we try to encourage those heroes in so many different areas. And we have our everyone from our truck drivers to our social workers to our frontline healthcare workers to those that are working on utilities to making sure we can be healthy at home to our grocery store workers to so many more doing an amazing job for us every day, even when it's dangerous. And so we love to see when we can fill up social media with the type of things that protect them or honor them for their work. Okay, so today we're going to talk more about masks, and they are more and more important. Trigg County heard that when we're talking about it, and they've been putting out masks that show off the pride in their school. We're going to talk about this in depth later tonight, but everybody in Trigg County is going to need one of these, and everybody else is too. All right, again, this is helping to provide the food for kids all across Kentucky. It's been something really special during this time to see the millions upon millions of meals that have been prepared for our children. Even in a time where we could easily be isolated, we could say we're shutting out the rest of the world, that we're going to almost shelter and everybody else is on their own. That's not who we are as Kentuckians. Instead, we have stepped up and we have taken care of each other. All right, so by the way, Vic Adams, who is one of our great leaders here in the Commonwealth has been honoring a healthcare hero every single day on social media. This is just the latest. It's a special thing that he's doing, but it's a special thing that all of our healthcare workers are doing too. All right, second grade kiddo. Again, our kids maybe get this sometimes better than we do. What we're going through, what it takes to step up to those front lines. Let's try to absorb a little bit of that understanding that we see in them to make sure that we get through this in a safe way. All right. This is, again, one of these things that we don't quite see the impact that this pandemic is going to have on people going forward. But I bet there's going to be a lot of kids that want to be in public health, that want to be a scientist, that want to be that next person who creates a vaccine, wants to be on the front lines protecting people. What's interesting is this is going to be a part of their lives and a part of what drives the next generation. And if we do this right and we protect one another, I think it's going to drive our kids as adults to be kinder, but also to be looking out for one another and to ensure that we take the steps to where we don't see this again in our lifetime or in theirs. All right, here is Owensboro, and again, lighting their facilities up green like we do to honor those that we have lost each and every night. All right, and tonight we have a message from Chef Edward Lee about the Team Kentucky Fund. Chef Edward Lee is a world-renowned chef that operates primarily out of Louisville, Kentucky. We've had so many people being willing to step up and to ask people, even in times that are difficult, to be generous so that we can help those that are struggling.
Hello, Chef Edward Lee. I know this is a tough time for all of us here in Kentucky. So many have lost jobs, so many are struggling. But we are Team Kentucky, and I know we will get through this. One way to help is through the Team Kentucky Fund. You can log on, click a few buttons, and give instantly. I just donated, and I'm asking you to give what you can. Donate $19 and then post about it with the hashtag Give19KY. There are no limits to what you can give, but every dollar helps. Your donations to the Team Kentucky Fund are tax deductible. Please go to donate.ky.gov right now and give what you can. Thank you, Kentucky, and stay safe. Hello, Chef Edward Lee.
And thank you, Edward Lee. So in coming through and passing this test of humanity, we've also committed, I think, to being better people moving forward. It's something that I certainly want to do, and I know that you do too. And one way is to make sure we can include everybody, which is why we're learning a little bit of sign language every single day. So today, we are going to learn healthy, together. And we already know together. So healthy, together. And let's do it one more time. Healthy, together. And I hope we have an opportunity to build on some of what we've done and to put it together. I can't tell you the response that we have had, whether it is children whose sign language is their primary method of communication, to others who want to be able to communicate with other children and other people. It's been just another special example how, and even in dark times, we can see amazing things out of each other. All right, so today we're going to talk about healthy at work. And we're going to do a couple things. Mainly, we're going to talk about, and Dr. Stack's going to talk about our phases in healthcare, of how we open up and the dates on that. We're just going to give a little bit of a preview of coming plans for other parts of the economy. Then we're going to talk about masks. After that, we're going to talk about testing and tracing, and then we'll go over the numbers. So Dr. Stack is going to lead us through our plan for reopening our healthcare economy. And remember, it's not by accident that we're doing this. It is because our healthcare industry, first of all, is necessary if we're going to ramp up our ultimate testing capacity, but also that we've got folks that are suffering from not having been able to get in and to see different types of healthcare professionals. And finally, listen, none of us want to be the canary in the coal mine. None of us have ever reopened an economy in the midst of a pandemic, and so other states can rush this. We're going to do it smart. But by starting with healthcare, with professionals that are used to dealing with contagion and other types of viruses, though we've never seen this one, we get a controlled and safe area to start this expansion in that can lead the rest of us. Dr. Stack.
Thank you very much, Governor Beshear. The governor's allowed me a few extra minutes here tonight to go into this because it's so important both for the healthcare sector but also for patients. And to pick up on something the governor just said about the need for people to have access to care, I have to emphasize for everyone, if you need care, we have said all along, if you feel you are having an emergency, if you feel you are sick, if you feel you're having chest pains or bad abdominal pains or severe headache, you're having problems for which you would seek emergency care, seek emergency care. The hospitals are prepared for you. They're ready. They have taken the steps to keep you safe. There's no better place for people to properly use PPE to keep themselves and you safe while providing you that care. So please, if you need care, seek it. I had a story from an emergency medical services professional telling me about some paramedics responding to a house and the patient refused to go to the hospital even though they urged the patient to go. Please don't do that. Please, if the professionals arrive and advise you to seek care, seek care. And while I'm on the topic, thank you to all the paramedics out there and the professionals related to them for what you do. So the rule for Phase 1 opening, the new executive order, is on the website now under healthcare providers on the website. So this addresses Phase 1 that began today. So for those of you who need to see this, you can find it on the kycovid19.ky.gov website under Healthcare Providers tab down the page a bit. James is here today. It was Greg yesterday, and I called Greg Kenneth because they were correct. I hadn't met Greg, so I used Kenneth as a position, not necessarily as a person. So I'm sorry, Greg, and thanks, Kenneth, for pointing that out. If you could put my first slide up, James, I'd be grateful. So for all phases of healthcare opening, I know you can't, it's maybe hard to read this, but I'm going to go over the key points. Folks want detail and they need detail. These are all on the website or will be very shortly. They're up there now. So if you look, we have swapped the slide decks on the kycovid19.ky.gov button that's near the top in the middle of the page, and these will be the slides that are there for phased healthcare reopening. In all phases, we expect and urge people to use telemedicine and telework whenever possible. That should be part of our new normal going forward, even post-coronavirus. People who go to seek health care should have fever and COVID-19 screening prior to entry in a healthcare facility. The healthcare facilities will come up with policies and procedures for how they're going to operationalize that. If you do what the hospital or healthcare facility asks you, you'll be in good standing. They have to discontinue the use of traditional waiting rooms and common areas and use non-traditional options such as waiting in your car, call ahead registration. Where it is still necessary to have some sort of waiting, they have to take steps to ensure social distancing greater than 6 feet. Plexiglass barriers are similar to try to keep a distance so that there's a minimization of spreading disease. There'll be an expectation of universal masking when you're in a healthcare facility. The professionals there will probably be using procedural masks and surgical masks. That's what we put in the new order. Others may use cloth masks and other sorts of face coverings. The facility will guide you if you are in compliance or not with the expectations. Enhanced sanitizing and disinfecting and hand sanitizer throughout the facility so people can at least have access in public spaces. Now this is important, and I want to be clear. We have tried to procure PPE in order to help with a coronavirus surge or a coronavirus wave. We have not provided or procured PPE to provide for regular business operations. So this is not intended to single out or punish anyone. It's that in order for healthcare to safely operate, it has to be able to get the materials it needs through normal channels to safely operate. So we're going to tell you here dates that you can potentially open back up, but if you don't have the materials you need to comply with these rules, then you can't open up. So you've got to be able to get the materials. And we've gotten a lot of calls on this. We are not trying to disadvantage anyone. This is one of our concerns, is we have to have enough PPE for everyone to protect both the healthcare workers and the patients. So if you can't get the PPE, then that means the system is not yet ready to support all the sites of service. And I'm sorry that that's the reality we face, but it is. No visitors except end of life or assisting vulnerable populations like underage minors or frail or infirm individuals who need help. That's the same that we already have in place. And all phases are subject to delay or rollback if we experience a COVID-19 surge. James, should we go to the second slide? I'm not going to linger on this one. Phase 1 started today. Now, healthcare providers may resume non-urgent outpatient healthcare services, including diagnostic radiology and lab services. This includes high-touch settings like physical therapy and chiropractic. In the rule that's on, or in the order that's on the website, it describes, in a general sense, enhanced expectations for single-use gloves when you're manipulating someone and some other precautions. So if you could go to the website and see that. Also, we ask you to use your professional associations for additional guidance so that they can give you additional detail about what steps to take to keep people safe. High aerosol settings like dentistry, I appreciate this. I've had a lot of communication and outreach from dentists. I personally can't get to all of you myself, I'm sorry, but we do get your feedback. If you go to the Kentucky Board of Dentistry, so it's dentistry.ky.gov, there is a link right on there that has the document that was created that I referenced yesterday, I think, at the press conference by the Kentucky Dental Association, the Kentucky Dental Hygienists Association, the Board of Dentistry, the Kentucky Department of Public Health was involved, Kentucky Oral Health Coalition, and 2 colleges of dentistry, one at UK and one at U of L. If you comply with what's in this document, you will have fulfilled what you need to do for phase 1 to reopen dentistry. I urge you to go there. We're not going to put a seal of approval on every guideline that comes out, but I will tell you that this fulfills everything you have to do to reopen your dental practice. Can we please go to the next slide? So phase 2, we put dates in here now so that the healthcare system can plan. We'll begin Wednesday, May 6th. So that's next Wednesday. Is it next Wednesday? Yeah. No, it's a week and a half from now. Time flies. So, yeah, it's next Wednesday. So Wednesday, May 6th. In this, you now will be able to do outpatient and ambulatory surgery and invasive procedures. For this one, again, this is a public-private partnership. We're working with the communities as much as we can. The Kentucky Hospital Association has created a document. I spoke with them this afternoon. They are going to post this on their website. This describes 4 phases of opening. If you follow the guidelines in here for phase 1, phase 2, phase 3, phase 4, you will be in good standing for complying with the expectations that we will have in the orders that we issue. In here, all the patients who are going to undergo a surgery or invasive procedure will have to have COVID-19 testing. And now this will change. Some of it is the nose test for the PCR that I've talked about many times. Others may be antibody testing as that becomes more reliable and hospitals have access to it, or you may have to have a combination of tests. Currently, the KHA document has information in there about an approach to testing. This will evolve over time, but the approach they outline in their document is one that is acceptable to the Kentucky Department of Public Health at this time. So again, if this applies to you, you're a hospital or an ambulatory surgery center, I'd encourage you to look at this because this will help you to comply. Every facility is going to have a 14-day supply of PPE on hand for their projected burn rate over the upcoming 14-day period. The type and timing of cases should be determined by a committee, a procedure prioritization and oversight committee, that helps to determine which cases have priority and which ones go and which ones don't. And for all acute care hospitals, they will also have to maintain at least a 30% bed capacity per their surge plan in both ICU and total beds for COVID-19 patients so that if there's a surge, they have capacity to handle the needs of the public. James, if we could go to the next slide. I'll get quicker because I'll only highlight the changes now. Phase 3 will begin Wednesday, May 13th. This will allow hospitals to go to 50% of their pre-COVID-19 shutdown inpatient procedures and surgeries. This will begin on May 13th. All the other requirements remain the same. And then, James, if we could go to the final slide. On Wednesday, May 27th, if we've had no surge and everything is proceeding as we hope, then hospitals may go back to their own self-determination about the volume and capacity that they are able to safely operate. But in all of these phases, they must still have on hand a 14-day supply of necessary PPE, a committee in place to determine which cases do or don't go if demand exceeds capacity, and they're going to have to retain some surge capacity in case we have a surge of COVID-19 patients. My final remarks would be this. I realize this has been a long time in coming, so here it is, April 27th, and we had our first COVID positive patient tested on, or resulted on March 6th. This has been a long journey and a lot of sacrifice. I continue to thank the governor for his leadership. I think he's been an exceptional steward for helping to keep you healthy, safe, and well. I thank him for his partnership because I couldn't have asked for a better partner in this endeavor. I urge you to not become complacent. Just because the disease right now seems to be at a plateau, it is not time to feel that you are safe. It is not time to feel that this is not still a serious threat. This is exactly the time when we are at risk for the greatest harm if people start to get lax about complying with the things we ask you to do. So we're going to work very hard. I'll work very hard with the governor and his team to try to find ways to gradually release restrictions so that we can try to get back to the things we need to do. But I urge and ask you, please, to comply with the requirements that we have, because if we don't, the very harm we have worked so hard and so successfully to minimize could very well materialize in that second bump that he describes in the St. Louis example. So thank you very much, Governor.
Thank you. Well, I got Dr. Stack to talk about St. Louis versus Philadelphia, so I had some level of success. I do, though, all these slides, I know they're hard to see for a lot of folks who are watching. They will all be on our website. They are very technical. They are primarily for the healthcare field itself, just laying out the primary guidelines. But going through this tonight, I hope gives you an idea of how we're going to gradually do this in a safe way with strict compliance to guidelines, and to make sure that we can do it in a smart and a safe way. And this is going to be the way that we are going to move into a broader Phase 1 reopening, Phase 1 being something the President and the White House use on their reopening plan. So we are going to start working through in different chunks, week by week, things that fall, or most of the things that fall in that Phase 1. And we're going to, later this week, probably Wednesday, talk about the first piece that we're going to try to put into effect May the 11th. And then every week thereafter, for 4 weeks, we're going to gradually ease some restrictions, bring some groups or some industries back online. It gives us time to get the right compliance, restrictions, guidelines in place, industry by industry, and allow it to go in a way where we gradually work up from those that might have some of the least contacts, or in an area where we already have a lot of experience on what we need to do. So we will have different either ease restrictions or more healthy at work happening on May 11th, 18th, 25th, and June 1st. And I think I said it yesterday, none of us have ever done this before, and we're going to need every industry and every group to stay patient with us. It may be you'll be planned for week X. It may be that you're in Phase 2, and that might be something that you're not happy about. But we've got to do this right, and we're going to do it the best that we can. And we also have to be flexible, because if we take a step and it turns out that we all thought it was the right step and it's not, we may have to pull it back ultimately to protect people. That's why we talk every day. That gives us a chance when to recalibrate and to move in the right direction. But as we move towards May 11th, And if you think about it, not just what we're doing right now, but as we're taking some of those steps and more of those steps, we're going to increase our contacts. So to give you an idea, if we're healthy at home right now, it's Brittany and myself and Will and Lila. That's our nuclear family. So there's 4 of us, right? So those are 4 contacts. And if we're healthy at home and it's just the 4 of us, you can think about how to flatten that curve. But then if all of a sudden we're healthy at work and I go to work and there are 10 people, right? And they each have a family just like mine, which I know isn't the case, but there's 4 more. That's 40 more. So I've gone from 4 contacts to 44 contacts. And again, we're just trying to have an example here that everybody can grab a hold of. So when we're going to do that, and remember, many works are more than 10 people will come into contact with, it tells you a couple things. Number one, how work can't be the same when we go back. We have to be further spread out. There has to be social distancing, and as many people possible who can telework have to be able to telework. But then there's something else that we're going to end up having to require. We talked about it yesterday, and that's masks. So by May 11th, we're going to be asking everybody in every area that we reopen and in our essential businesses to be wearing masks. This is how, even when we are plateaued right now, that we think that we will be on the decline, we can help to reduce the spread of this virus. Now, given that we're all increasing our contacts, right? All out there, all at a time, increasing it in different ways, we're also going to need people to wear these to the grocery store or other places that they're going out where there are other people. Now, if you go on a run and it's just you, you don't need to wear this. If you are in your home and it's just your family, you don't need to wear this. But this does help us open different things a little bit earlier. So we're trying to give everybody 2 weeks to go out there to get a mask. We will try to have different programs. We're handing them out in Louisville and Lexington this week. But this is something that we're going to need to do. Now it's going to look strange. And it's going to look very different to us. And it might be a little hard on all of us to take in, but I want to make sure as more people are able to go back to work, we're able to open other things. As we work through May, I want to keep us as safe as possible. And so while it's going to seem strange and it's probably uncomfortable, I want us to know that this is just another small sacrifice that we can take to make sure that we keep each other safe. So 2 weeks. Make sure you get out. If you are not a healthcare worker, you should not have an N95 or a KN95 mask. You don't need a surgical mask. What you need is a cloth mask. And tomorrow, I think we're going to show a video of how to make one. And we're also going to have a show and tell, for lack of a better term here, on how to fit one. This is something, until we get to a vaccine, is going to be a part of our new normal. And it will just make us miss a little bit of what was normal before, a little bit more. But this helps us to take the steps that we need while still staying safe. All right, testing. We have, and this is just at least 11 different testing sites this week. We've been working today, and I hope to have more information tomorrow about other testing sites that are all around the state. We're making sure before we put them here that they have sufficient capacity, because we've heard from every one of these locations that we hadn't talked about before that they have more demand right now. The people want to get tested, and we want to make sure we can provide you that information to get them tested. So we started today in Louisville and Lexington, and as of 4 o'clock in Louisville, we tested 256, and in Lexington, 286. We are going to hit the goal we had today of over 300, if not to exceed it. We've also handed out masks and hand sanitizer at each of those locations. Tomorrow, we start, and this is all in our Kroger partnership, Bowling Green and Owensboro. Bowling Green's been hit really hard, Owensboro too. And so we are going to now go Tuesday through Friday in Bowling Green, and we're going to do the next week, Tuesday through Friday. In Owensboro, we're going Tuesday, Wednesday, Thursday, but they reached out too. And so we are working now with their local health department to where that next week we're going to provide tests. We're going to leave up our tents and the other infrastructure that's needed, and there's going to be continued testing, albeit at a slightly lower capacity in Owensboro for at least part of another week. So to those out there in Davis County and the surrounding community, we've heard your needs. Your folks have stepped up. We're going to provide and pay for those kits and the shipping, and we're going to make sure that you get extra testing. Again, a number of other options that are out there. If we can go to the next one, these are our Kroger. And I will say, if you go back, these are now all booked for this week. The Kroger sites are fully booked. Wednesday, when I'm up here, we'll talk about it being reopened. It'll reopen on Wednesday during this press conference, so be ready if you want to get that next week. Remember, there's a Walgreens and a Walmart location, Walgreens in Lexington, Walmart in Louisville. You can look on our website to sign up for those. They are for not just for everybody, it's for those with symptoms, first responders, and others. Rockcastle Regional Hospital, Callaway County Hospital, Primary Care Center and Hazard, all out there, Trigg County Primary Care Clinic and Katie's. So we have regional areas all around Kentucky, and this is only going to increase. This should be the largest number of tests this week that we have done in any week, and I hope it's by a significant factor. That's our goal as we scale up, and bringing healthcare online a little earlier is going to help us, especially as we move potentially to antibody testing sometime in the future. All right, let's talk a little bit about tracing. So the future, until we have a vaccine and testing, is about a vaccine or a treatment method that really works. Is going to be about testing and tracing. We talk about how the world will look different, and it will, and your workplace ought to look different. If the same number of people are in your workplace when they reopen as they were before it closed, you're doing something wrong, right? If the way you operate is the way that you did before everything closed, you're doing something wrong. So it all ought to look different, and I know people are bought in to do it. Both my conversations and surveys of the business community, they only want to reopen if they can do it safely. And for that, people are going to be safer, and you're just stepping up and showing what great Kentuckians we are and what great Kentucky businesses we have. So it won't just look different because it will. It's going to be different to the extent that temperature checks, every day in virtually every business. And somebody spikes a fever, we're going to work to have testing hopefully available to where a test can be there immediately if somebody is testing positive. It's both them and their closest contacts that are going to have that 14-day self-quarantine. And so businesses are going to have to be prepared for it, and individuals are going to have to expect it. But to do that, we have to have an infrastructure to do that tracing, to make those calls at a greater level than we have ever had before. And so we are working on more than on a plan. We have a plan where we're going to have over 700 additional people, and Jefferson County is going to add people on top of that to help with contact tracing throughout the state. We're going to have about 20 more in our state Department of Public Health. We're going to have regional folks, including kind of overall administrators, special investigators, and others. And we're working on that directly. And then we're going to have an RFP out this week for private sector partners that can help us with a little under 500 additional folks to help us, once trained, to do contact tracing and to help every local health department throughout the state. Using it this way, we can leverage those private sector resources and ramp it up real fast, because we're going to need those slightly short of 500 people here in the next 3 weeks when we look at the reopening plans, and also to provide the computers and the phones, other infrastructure. I don't want us to not meet the goals and the deadlines of having people in place. So when we have that out, I'll announce it here. It'll be up online the way it normally goes to make sure we get the very best responses. So that will be, again, phased in, phase one, gradual strict guidelines, making sure we do it safely, starting May 11th, but also working up each week with some additional things coming online. And remember, even in your own business, if you're in one of those weeks, you should phase in very gradually. We had a proposal that I saw today from, I think it was Maritime Manufacturers, that was exactly what we're looking for. It was very responsible. It was exactly what we're looking for, that same phased-in approach and really thinking through education to employees and the way that we do things differently. All right, so we have our numbers today, and for the most part, they are very good news, though they are certainly impacted by when labs are closed and when they report. So we'll have to watch tomorrow and even on Wednesday, and that's why we got to kind of balance these out on a 3-day average or sometimes even a little more. Because when we had that day where we went over 300, the day before and the day after weren't over 300. So remember, we're not just taking every day individually. We're looking at it all together. So today, I'm announcing that we have 87 new cases of COVID-19. This is the lowest number I think we've had, maybe even in a couple weeks, or certainly one of the lower numbers. Again, we can't read too much into that because of the reporting, but unless we have a really large jump over the next couple days on the average, I think we have certainly plateaued, and my hope is that very soon we will be headed into our decline. Again, it's everybody wants to be in decline. Everybody wants to be out of it. I want to be out of it. But to say that we are not peaking, that's a very good thing. That we are plateauing, another really good thing. And that we hope to either be in or see a decline soon, that's a third good thing. Remember, there's light at the end of the tunnel, but it's going to take work and patience to get there. But I see it, and I am hopeful. So we have 87 new cases, and then we're adding another statistic we report now, which is probable cases. We have one probable case on top of the 87 new cases. And I'll talk about that a little more when we get into some of the other data. So after we remove 15 duplicates or people out of state or who don't meet the state guidelines, our total number of cases is 4,146. All right, so our total number tested, this shows you if you look at yesterday that part of what we see today is not a lot of reporting, 48,799, right? So that's one of our smallest jumps in total number of tests. We're going to have a whole lot come in based on gravity at the end of the week here in the next couple days. Total number ever hospitalized, 1,281. Currently 313. Ever in the ICU, 612. Currently in the ICU, 165. I think up one from yesterday or right around there. So again, let's think about them. It means maybe we've had one come out, maybe we've had one come in, but we still have Kentuckians that are there and need our thoughts and every bit of help we can provide to their families. Total number recovered, 1,521. Every single one of those a victory, and I know something special for those families. Cases by county, new cases by county, Jefferson 25, Warren 18. Again, want to know why we're going to be in Bowling Green and Warren County for 2 weeks? The answer is we need to be, and we're going to be there for you. Graves 5, 4 in Campbell, Hopkins, and Kenton, 2 in Boone, Bullitt, Davis, Edmondson, Hardin, Henderson, Marshall, and Meade, and 1 in Allen, Barron, Carlisle, Christian, Fayette, Knox, Marion, McCracken, Pendleton, and 2 unconfirmed. We talk about it being everywhere. I know for a while, at least 3 out of 4 of our Mississippi River counties in the Purchase that are right up there against the Mississippi River, we hadn't seen cases in, and now we are. We're seeing some every day, every third day. That's just because they were always there. And as we ramp up testing, we had it in Paducah. Now we're getting that accurate data. So we all need to do the things to stay safe no matter where we are in the Commonwealth. Tonight we also have another lower, though not as low as yesterday, number of new deaths. And while any new death is tragic and it's unacceptable because we want to make sure that we do everything we can to save everybody. The fewer the numbers, the better. We know this virus is going to take people from us. It already has. But the fewer every single day, we ought to feel like it's a victory because there are other people out there that we have helped save. But for those that we've lost every day, let's know their families can't see it that way. Let's know that they can't be together in their grief. We read the stories, or we hear the stories about what a funeral is like right now, and I can't imagine. You know, my grandparents ran a funeral home in Dawson Springs, and I remember one of the last times that my extended family came together was my grandmother's funeral, which was after my grandfather's funeral, about a year and a half later. It's just one of those times where you come together, you reconnect, and you grieve together, and it's hard right now. And so let's remember, for all of these families, it's even tougher than it would normally be. So today we have lost 5 Kentuckians. We have 5 new deaths to the coronavirus. Again, they are, and then we have 1 probable death due to the coronavirus as well. And they are all more than ages and genders and counties, but that's what we read every night. 73-year-old male from Fayette. We've lost 2 more individuals from Hopkins, an 81-year-old female and an 88-year-old female, a 90-year-old female from Jefferson, and our probable case and death is a 62-year-old male from Jefferson. So let's continue to light everything up green. The Capitol Dome going to be green. The governor's mansion is going to be green, but more importantly, your house is going to be green. And the institutions in your city and your county are going to be green. Listen, they light things up here in Frankfort, different colors at different times, so I think this is more meaningful and more special. But each and every one of you that adds to it, where when somebody grieving drives around their neighborhood and they see 10, 11, 12 of these in different houses, that really means something to them. And it reminds us that we are not alone, because we're not. We are not alone during this. All right, ethnicity and race. In overall cases where we know, 75.3% white, 13.9% black or African American, 5.87% Asian, 4.83% multiracial. Ethnicity, 91.5% non-Hispanic, 8.5% Hispanic. On the death side, where we know in terms of race, 78.69% white, 18.02% black or African American, 2.19% Asian, and right around 1% multiracial. And then of ethnicity, again, it's really about 99% non-Hispanic and 1% Hispanic. Very briefly, I want to walk you through a couple of the areas where we have seen major outbreaks and facilities, and give you an update. Green River, first, we have 10 new cases in Green River. Remember, we are testing more than ever before, and I've committed to testing everybody in Green River, and I reconfirmed my commitment and my direction and my instruction that we're going to test everybody at Green River. We are shipping those test kits, so we have 10 new total cases, 3 inmates, and 7 staff there. Something that we're working very hard on, but yes, it is a scary and a dangerous situation. Long-term care facilities, smaller numbers than we've had, but still tough ones. We have 9 new residents, 4 new staff with the coronavirus, and 3 additional deaths. What we have seen is 40+% of all of those we've lost to the coronavirus have been in long-term care facilities. And again, that says that every step that we take, we have to make sure we're thinking about what ultimate ramification there is here. And we are working hard We are providing PPE to the facilities that are participating in our program. The federal government is directly sending PPE, something that I know I pushed in a call to the vice president about this being the area where we needed the most help. That was several weeks ago, but he was hearing that from other people in other states as well. Was very cognizant of the real challenge. Is not the right word, but it's the best word that I have. The real danger that is there, and we're working hard. Sadly, remember, in some of these facilities, when it gets in there, we can do everything humanly possible, and sometimes it still won't be enough. But it's still our job to do everything humanly possible. All right, we'll move into questions. We got about 10 minutes. We have 4 reporters here tonight. We have Phil Pendleton, Karen Czar, Catherine Collins, and Joe Sonka, and I have a handful of written questions as well. I'll go through one of the written questions, and I'll start with Karen. Bowling Green testing. When is it? It is Tuesday through Friday. Is it full? Yes, it is full this week. What other options are there? We will have testing Tuesday through Friday of the next week. It's not necessarily close, but there are other options to you when you look at that map. Now, if you are symptomatic, you can contact your healthcare provider, and there are other ways to get tested. And what can those do who still want to be tested? If you are not symptomatic, this Wednesday, you can register for next week. If you are symptomatic, call your healthcare provider. Hospitals are getting kits from us, too, that are specifically designated for that population. Karen.
Governor, on May 11th, when you're asking people to wear masks if they're anywhere with a large group of people or at work, will they be cited if they don't? Can businesses refuse to offer services if they don't? What will be the ramifications?
So the question is, on May 11th, when we want people wearing masks, what are some of the enforcement? The first question, is an individual going to be cited? That answer is no. I mean, that's not going to get us where we need to go. Yes, you're going to be asked. If any of our enforcement folks see you, you're going to be asked to put on a mask, and it protects you. And it protects those that are around you. Now, on businesses, this is mandatory. And so if a business is not masking, well, that can be grounds ultimately to temporarily shut down that business. Grocery stores and others, I mean, we're going to certainly give any forward-facing business, as we slowly reopen them, the ability to not serve folks who aren't masked. And indeed, it's your job when you got one of those to ensure the safety of everybody inside, knowing that it could cause harm to your employees. So we're going to need some enforcement on that end as well. But this is something that I hope we all grab onto. It's something that lets us do our reopening sooner rather than later. And it's something, again, I mean, nobody's going to get cited and nobody's going to get arrested. But if you're not doing your part, you're that exception that spreads the coronavirus. Don't be that person. Be that person that realizes this is our next step. It lets us do more. It lets us get out more. Because my hope is in May, we're going to be able to start relaxing some of the restrictions on socializing in very small settings and seeing other people. So that's going to be important there too, with the social distancing as well. Owensboro testing. We understand there was limited availability as of last Friday. Have all the appointment spots been taken up? Yes. But we're going to be able to announce with local partners there about how we're going to be able to provide more testing going into a second week. It's going to be performed by our local partners with our test kits and the ability to ship them through UPS. It won't be quite the same capacity every day, but it's the way that we're working to make sure we have additional capacity. Catherine.
Talking about May 11th and the 4 weeks following that, is that breaking up the White House Phase 1 into 4 weeks?
The question is May 11th and the next day breaking up the White House Phase 1 into 4 weeks, and that answer is yes. Though we may have, it's very Kentucky specific, we may have a couple of things that aren't in Phase 1 for the White House that we're able to do based on the way we do business in Kentucky. There may be a couple things that are in the White House's proposal that we're not able to do. But what that lets us do is, even if we haven't had that 2 weeks of decline, to slowly ramp things up, and it's going to be based on different industry or different associations, and also our ability to get through the plans and make sure that they are safe. And just because the dates come for a specific area, and just because the guidance is up, remember, you still have to be able to live up to that guidance. So if you don't have masks as a business, if you can't do temperature checks, then you're not going to be able to reopen. You have to be able to live up to the minimums that are out there. But we're hoping this week to really begin to flesh out where it is, because let's also remember that if we said you can go tomorrow, most people couldn't go tomorrow. It takes the planning, it takes the preparation, reaching out to the employees. So our goal is to do this, and again, the people of Kentucky want us to do this carefully, want us to do it in a way where we don't cause another spike, but want to hear about how we're doing it and when we're going to be able to do it. So being able to put some real dates on that. 14-day decrease in cases. Will it be a 3-day average? Will it be a rate? We're looking at all of that. I know people want that exact number that you look at. What I look at right now is I look at 3-day averages. I look at the daily rate versus the total testing. I look at where testing is. Is it in our long-term care facilities, or is it in the general public? Was the testing open to everybody in the general public, or was it open up to those that only had symptoms? But the fact, if you look at the amount of testing we're going to do this next week, a lot of that's going to melt away. Once we reach a significant overall capacity, we're going to be able to be much more. We're going to get a much clearer picture about a decline. But I could say right now, we believe we're on a plateau that we won't know until we're a couple days in, based on the averages, if we're on the decline. For instance, we look at the cases today, and we're pretty sure that's because we didn't have that many tests come in being reported from Sunday. But when we see Monday, when we see Tuesday, when we see Wednesday, could we be on the decline? Possibly. But you got to look at all of them together. Phil.
Someone told us today that the Lexington testing went very well. They only waited like 15 minutes. Is there a potential
That's
there
great.
to increase the capacity there, and possibly have even more testing?
I'm going to have to repeat that question. Phil says that his reports today were that the Lexington testing went very well. Thank you to Kroger for that being the case. Is there a chance to increase the capacity? We kind of take that day by day. Right now, it looks like they're going to reach, other than what we were able to do in Pikeville when all the kits hadn't been used for 3 days. We're gonna reach exactly where we want to be on a day. And if we continue at that rate, we will probably expend all the testing kits that we have. That doesn't mean if we're able to keep that up for 3 days that we potentially can't look at the next week. What we're limited by isn't as much of the test kits, but we got really hard workers at Kroger that are doing long days, and so we'll have to look at what's possible there. But doing the 2 weeks, having the Walgreens site as well, and looking for other partners, we hope there's more that we can do out there. Dentists. Dr. Stack, were you able to, you were able to, again, talk about dentists. If the guidelines are out there, if you can meet the guidelines set forth by their association, is that the Kentucky Dental Association?
A whole bunch came together, and it's on the dental board's website.
It's on the dental board's website. That is what is within our executive order that is out there, if you can meet those standards. But if you can't yet, and a lot of you can't because you got to do a lot, don't open until you can. Don't put your clients at risk. Don't spread the virus. So take a look at them and take your time to get there. I'm willing to wait. I'm late for a checkup, but I'm willing to wait to make sure that it is fully safe. And to Jason out there, who's my dentist, he can bet I'm going to be looking to see if he's met all of those guidelines. Joe.
My question might be for Dr. Stack too, but could he walk us through some specific examples of what are permitted surgeries, procedures, and phase 2, phase 3, phase 4? just so we have a better understanding of what we're talking
So the question is, Dr. Stack's coming up, is can he give some examples about procedures that will be allowed in Phase 2, Phase 3, Phase 4?
So thanks, Joe. So for today, this week, if doctors and clinics and other healthcare providers are ready, you can go to a doctor's office and see your doctor. They could draw blood. They could send you for an x-ray test of some sort. They could do regular kind of office-based care. For the Phase 2, that would be if you need to go to a surgery center and have your knee scoped, or you need to have an endoscopy. You need to have a procedure where you normally go in and go home the same day. That would be the typical thing. There are some instances where maybe you go in for a heart catheterization, they find something that has to be treated, and you spend the night because they find something at the test that they have to act upon. That would be the kind of things in Phase 2 in general. Phase 3 would be you need to have a significant surgery or a significant procedure. You go to the hospital and you know you're likely to spend 2 or 3 or 4 days in the hospital after your procedure to recover. That would be Phase 3 and Phase 4. And the only difference between 3 and 4 is the hospitals have to only operate like at half capacity in Phase 3, and then Phase 4 they can go up to whatever their new normal capacity is. Does that address your question?
And I know those that have been with us every day know that that's because we've still got to protect against that potential surge. All right, we'll do 6 more, 3 here at 4. We'll do 8 more, but I'll do them really quick. Karen.
Governor, I know you may not have the answer today, but if we could find out, I know some of the site locations were chosen to get near the African American communities more so since they're so disproportionately hit by this.
Right.
Do we know yet if that is working, or we won't know for a while?
The question is we located our facilities near African American neighborhoods in Louisville and in Lexington to try to better serve those communities. We're going to have to see as we serve people how well we're doing there, but I'm committed to making sure that we do significant testing there. And if it can't be achieved in this model, because this model has only worked when we open it up the way that we have, we'll find another way. We're committed to getting that done. All right, from WKDZ, how are we determining where screening stations are going to be set up? I think this is a question about testing stations. It's number 1, rate of infection. Number 2, where there has been testing in the state before and where there's other testing capacity, other labs. And then in actual locations, that's established by emergency management. They have to ship some very sensitive things there. We have to be able to provide sufficient amount of security. There's a lot that go in to how we do it, but our goal is with the way that they travel around to be where we're needed most, but also to be regionally everywhere, at least in a 2-week period. Now, we're going to work with more local folks on being able to set up what we can set up. Our goal is to increase our capacity. So every time, in Owensboro, Public Health, Davis County Public Health Groups comes together and says, we can do this piece if you can provide us the other, then we're able to do that much more. Catherine.
Have you talked recently with the governors that are part of that partnership, and are you on the same page with them when it comes to your
I've talked with the governors that are part of our coalition. I also talked to Mike DeWine and Eric Holcomb separately. We've been talking almost since this thing started, and we're all generally on the same page. There are a couple of different ways we're going about it. I think that when you look at what everybody's doing in the country, we're not being the fastest, but my hope is that we are the smartest. We are certainly not the slowest. We're probably not even the average, but we're one of the few states that is leading with health care. In a phased way where we even phase up to what some others are doing. But we all talk, it's very collaborative, and we're all trying to achieve the same goals. We just think it works a little bit differently in different states, but we're sharing a lot of information, which is really helpful, and our commissioners of public health are also speaking. So while the details might not be the same, I think the overall themes and movement is. Some restaurants do takeout, but bars and clubs cannot and are reaching the fear of closing permanently. Can owners, employers see any light at the end of the tunnel? Yes, but it's going to take some time. Certainly bars and clubs we don't see until probably right now, at least in June. And I know that's hard, but that's where the contacts can grow so significantly. My job's to be as transparent as I can, and as we sat down and see where cases are following the White House's guidance on where those fall in phase 2, bars and clubs, that's what we're looking at. We're hoping on the restaurant side to be able to do some things before. We are going to show you at some point an illustration of how this virus can spread in places like restaurants, to give you some examples of why we're doing what we're doing. And then that hopefully gives those proprietors who I know want to reopen when they can and do it safely some ideas about how they can reduce the possible spread. Phil?
We got an email today that says Kentucky Kingdom is planning on reopening around the 1st of June using a bunch of guidelines. Any kind of comment on that, or is that?
Well, Kentucky Kingdom is going to have to come to us and talk to us. We have an order out there that says no mass gatherings. And that's not being negative towards them. I haven't seen their plan on it. But absolutely has to work with the state in a time of a worldwide health pandemic. Now, I know some of the folks that own or operate that, and I hope that they will work with us. But in a normal operation like that is a ton of people who are together and around one another. So we're going to have to take a very close look at that. I know the margins on those things can be hard, but we can't allow just a margin to lead to a huge spike in COVID-19. Let's see. Unemployment, I think I mentioned. A listener who lives in Bath County and works in Fleming County says she's an essential worker but is unable to find open nearby child care facility for her foster child. She's worried she might lose her job over that. All right, this is going to be one of the tough things, and we need to go ahead and make sure people are prepared for it. And we're going to show you an example tomorrow. But even as we're able to do some of these things in May, we're not going to be able to open child care or youth activities that have been closed to this point. And just to give you an idea, remember when we talked about how if I live in a home of 4 and I'm healthy at home, I have 4 contacts? And if I go to work and there are 10 additional people and they're doing what I have, I've gone from 4 to 44 contacts. Well, if my kids go to a daycare, with 10 other kids who are in the same situation, whose parents work in different places, that's an additional 44 contacts for every single kid in that daycare on top of it. And all of a sudden you see how we just exponentially increase. That's what concerns our public health officials. That's why the White House has said no daycare reopenings in phase 1. It's going to be really hard. But if that was a requirement to reopen work, we wouldn't be able to reopen work in the way that we are. So people ought to start thinking through that. I know it's really going to be a challenge to folks who might already struggle, but we can't take the steps that we would otherwise be taking without that continued restriction. All right, Joe, take us home.
Following up on what you said about additional employees for contact tracing.
Yes.
Did you say 700 total, or 700 and then the 500 from the RFP?
It's going to be 700, 750 total, but that's not going to include what Jefferson County is going to hire on their end. We're going to provide all the technology, including for Jefferson County. They're going to use their dollars from the federal government to fight COVID on their personnel. But we're working with them real closely on the technology, and I'm on a call 3 times a week with the mayor of Lexington and Louisville, being 2 places that have been hit hard. The way that breaks down on the 700 total is about 20 more in our state office, and then a pool that we're going to hire but are going to be regional, and then a little less than 500, 450, right around there, that are going to be part of the RFP. And those are the direct contact tracers that are going to work with the local health departments. All right, we went just a little over tonight, but I wanted to make sure that we got this important information out. Folks, I am hopeful, even though I'm wary. I hope by now, how much I care about your safety and the steps that we've all been willing to take. Orders that I've put out, but the reason we've plateaued is and we're flattening that curve is because of you. I believe that we can do this gradual reopening with strict guidelines that we're going to need in a very safe way. But we need your buy-in on that too. We need to make sure that we're not moving too fast and that we do it the right way, but that you have confidence in the steps that we are taking. And I will tell you that at any time any of our steps causes a spike or is starting to put us in a situation that threatens our lives and our health, you can bet we will make adjustments. We have come so far. We can see the light at the end of the tunnel. It's still going to take some time, and once we reemerge, it's going to look different until there's that vaccine. But we can do this. We are Team Kentucky. We have come so far together. We can defeat COVID-19 on the first try. So remember that we're going to get through this. We're going to get it through it together. We'll see each other at 5 o'clock tomorrow night. And we got a special closing from Owensboro Health honoring a lot of those folks that are out there working for us every day.